Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello everybody, this is Dr. Grande. I'm here today with a special guest, Nate Smith, LPC. Hi Nate.
Hello, hi.
We're going to be talking about a variety of issues, kind of like the culture of YouTube and how channels attract attention, and kind of tap into some of the recent things that have been going on. I think it'll be an interesting conversation for everybody. So, want to lead off, Nate? What are you thinking?
Sure. So I think one of the things, we've gotten to know each other over the last, I want to say, probably 3 weeks now, right? Or going on 2 weeks at least. And just I guess it'd be good to just sort of simply review, the recent controversy about mental health and how it intersects with sort of pop culture YouTube or popular, media and those sort of, quote unquote drama channels. And I use that rather derisively because I know that there's some sensitivity, and I also would, we could take that apart too if you wanted at some point. Anyway, so we sort of met talking about that. And you and I have offline have had some really nice conversations, I thought, about talking about what is the line, what's the boundary, for talking about mental health in a way that is, ethical, appropriate, tasteful, but then also being able to engage a community that maybe isn't necessarily seeking that out, right? And finding a way to do that is meaningful, but also that, that's tasteful and ethical and careful to not implicate certain, sort of things in diagnostically speaking or so on.
Yeah, this is an excellent question. This is the struggle that we've, again, both talked about kind of when we're not recording. And, in a perfect world, right, we could use our education and training and our ability to kind of dig into the research and pull out information and our experience and make videos, and they would reach everybody that would be interested. Mm-hmm. But in the real world, YouTube is highly competitive. Mm-hmm. There's other social media platforms that compete with it as well, and that don't really involve videos. I think some that might even involve videos. Mm-hmm. So what you really see with YouTube, I've noticed this over, I guess, almost 5 years now I've been on YouTube, but especially in the last year and a half with the kind of format I have now, is that you're really rewarded when you push the edge, like when you get close to the boundary of whatever you're talking about. Right, so it doesn't matter if it's mental health or if it's somebody else doing another type of channel. It's about like pushing it to the extreme, and that in a sense, I guess, maximizes the number of people that'll watch. And I think too, YouTube is primarily an entertainment platform still. Like if you look at the videos, so we're kind of like unusual figures, right? Kind of like encroaching, right, interloping on this world of like drama, entertainment, sensation-seeking, to some degree impulsivity, right, is rewarded on YouTube, right? Spontaneity, all characteristics that I try to avoid in my videos.
Right.
So, it's a difficult question. For me, there's something that doesn't feel quite right about like trying to make thumbnails that are really super attractive and super provocative when you are in fact talking about science. You're talking about mental health experiences. It's very down to earth stuff. Right. Nothing in one of my videos should be shocking or dramatic unless you're really interested in like nuances of mental health disorders and things, right? For me, it's still, for me it's exciting, right? And obviously a lot of people that watch, it's exciting for them, but the wider audience, right? I don't know if we just, at some level, I wonder if we have the appeal doing what we do to reach out to an audience like some of the more dramatically oriented channels can access.
Yeah, and I think that's an excellent point in that, the fringe piece and kind of figuring out, because you're right, I think a lot of people that are going to, so I guess a little context for me, I'm brand new to YouTube. I made a response video that got nearly 3,000 views, and I was like in love with it, right? I've been a YouTube fan and viewer for many, many years. Going back to when you had to wait for it to buffer, right, to watch the video. So, I mean, I've seen and watched YouTube evolve over time, and as well as the sort of original content. It used to be bootleg videos and things like that. And now there's original content producers or creators. And so, you're absolutely right in that there is this, it rewards entertainment. It rewards that provocative edge pushing, right? And then it's also kind of this, it's very niche oriented, because for some people, I mean, many people on YouTube, it's a business, right? It's a way in which they establish their brand or establish their voice in an effort to seek some sort of monetary gain, I think. Mm-hmm. And so, for us who are, I mean, I think that, money and mental health, that's a whole other video, I think, on some level. But, we're in this weird position because, as mental health providers and as educators, we're not necessarily inherently good at knowing how, to pursue the dollar, right? To follow the bigger, better deal, to know the financial trends, the way to monetize things. Now, if it happens along the way, I think it's obviously it's a benefit, and we're not going to say no. I think on some level, so long as it's ethical and, we can keep our integrity intact. But, and so it's for me, and in my observation of mental health channels on YouTube, being very niche, a lot of people have to sort of find us or seek us out. And so, we've seen with the recent provocative sort of controversy, I'll say, is that there was this tapping into the zeitgeist of YouTube, right? That edgy, sort of provocative, and it intersects with mental health. And a lot of people reacted in very strongly. And I'm interested in that because, I mean, there was a lot of like condemning back and forth, whenever, but I was interested in knowing, wow, mental health is is very, we're talking about it in level, and in spheres that aren't necessarily talking about it, right?
Right. And here's I think what it comes down to in one sense, and we kind of know, we know how the story has unfolded so far, and we have seen things happen on other channels. And I guess kind of what I wonder is if somebody's attracted to the drama component of mental health, right? If that's why they're clicking on a thumbnail, because they want to hear about a YouTube celebrity or a quasi-celebrity, and they want to hear about their mental health status or something about, something that's went wrong in their life or symptoms, whatever. Is that the viewer that's really kind of primed for an educational message, right? And it may be. I don't know the answer, and they may be, or certainly a proportion of them would be. But I also kind of think maybe a fairly large proportion would not be. Like they're kind of looking for that, again, more dramatic, more sensationalistic content. And if it involves mental health, great. If it doesn't, great. But it's not necessarily an attraction to psychopathology, appraisal, counseling techniques, like all the things that we would talk about. So, yeah, I mean, we can definitely, I think, do things to position certain videos in a more attractive way for a wider audience. But is that really going to, is the message really going to penetrate at any higher rate? That's kind of what I wonder about.
And that's a fair point. I think, is the viewer in a place to hear what we have to say, right? And it's almost like accidental education, right? I came here to be educated, I came here to be entertained, not educated. And I that's a fair point. And I don't know. I think, I've been playing on my channel, again, being brand new to this whole, creator perspective, I've been playing around with lots of different things. Is there a way that you can come, because we know sort of what not to do now, right? The last, say, 3 weeks has taught us that. And as professionals, we take heed quick, because we've got a reputation to maintain. And so we know what not to do, which in my opinion, I'll say this to my clients often, we know what doesn't work is as helpful as what does work, And so in my investigation of how do I find the proper sort of combination or permutation of content that's engaging, that'll attract that'll make the algorithm have a awareness of me as a brand new creator, that entertains on a certain level, but that also does that sort of educational piece. And to varying degrees of success, I think on some point, if you see my videos, the highest videos are my response videos to the drama. So, I think that sort of speaks for itself. But, it's an ongoing sort of struggle, I think, for many. I mean, this is not sort of unique to creators in general, right? As mental health creators, we're certainly we're not alone in trying to get that algorithm's attention.
Yeah. And you think, there's a couple different ways to think of yourself as ranked with YouTube. I mean, at one level, you're competing against other channels like yourself, right? Other professionals. And, you make a video on, I don't know, like borderline personality disorder, and I make a video on borderline personality disorder, and so do 20 other clinicians and advocates. How do you get higher rank there? Mm-hmm. But then, kind of that higher level question is, can we in any way kind of unlock that other market to get that other viewer that maybe wasn't interested in, again, the nuances of borderline personality disorder, but there's something that we tap into that's trending, or some using somebody's name that attracts attention without really talking about them. And will that hold their attention? And will that really, again, kind of get that message in? And it's tough. I don't know if there is a happy balance. I don't know how close you can get to that fire without getting burned. I mean, we've seen, like you said, we see what happens when you go too far.
Right.
And it can give you short-term, like, explosive growth, and then it doesn't work out too well.
Right.
So we've kind of seen a template for, one extreme. And it's pretty unlikely that either of our channels will ever reach a point like that.
Yeah.
That's not our type of content. So,
right.
It's, for us, it would be a much more gradual move and small changes to see if we can approach something more kind of attractive in the as the thumbnails line up or whatever. But yeah, I've given this a lot of thought. I've looked at analytics for a long time. I've studied trends. I've seen how certain videos have performed. I think sometimes when people look at mental health channels, they just assume, at least a proportion of people would assume that we're just kind of doing our thing. We're not paying attention to the larger YouTube picture.
Right.
And part of that's fair. But the other part is, I have been, and you have certainly been, very tuned in with what's going on, watching a lot of other videos. When I first started making videos, I didn't watch anybody else's videos, right? When I first started making them, I didn't know what a subscriber was, right? I saw the counter move, and I'm like, what's that number?
Oh, look at that. How about that? Yeah, right.
Yeah, I didn't even know that was a thing, so, and that was like, for a substantial period of time. Like I was making videos for months and months and months, probably even all of like 2014, my first year. I'm not sure I really ever got what subscribers were, what they did. And then I started paying attention as that number grew and people started commenting and stuff. But that's, more so since 2017, because statistics videos don't really attract, big audience.
It's a very niche audience, right? Absolutely.
Yeah, so to use Phil McGraw as an example, right? The guy who calls himself Dr. Phil on the TV show, right? He has a PhD in psychology, if I'm not mistaken, but no current license. So at one time he was licensed, and now he's not. And if you look at his show, and of course he has a YouTube channel that goes along with that show, his videos, I mean, he really centers on individuals who have kind of mental disorders that are going to attract a lot of attention, attract a lot of interest, right? We see a lot of infidelity being talked about there, a lot of kind of emotionally assaultive behavior and drama, sometimes paraphilias, sex offenses, things like that. So he's really, he's pushed the envelope, but he's, in a sense, since he's the only one doing that in television, really, I think he's kind of legitimized that just by being the only one and by being a PhD and everything. But I actually think what he does is, like, not him personally, but just that whole thing, right? That whole show, that whole concept. I don't find it as a kind of a positive force for mental health. I think, yes, it gets views. I was looking at a video, even I watch them sometimes, right? I saw a video of his that was pretty
Exposed.
old. What's that?
Sorry. I said exposed. Sorry.
I saw a video of his the other day that had something like, I want to say 5 or 6 million views. And I think the comments were disabled. So it must have been a kind of got a little out of control there. And you think, okay, comments disabled. You wouldn't think that video would get surfaced too much. It gets surfaced a lot, and it has 5 or 6 million views. So he's been rewarded for, going way over the boundary, in my opinion.
Yeah.
That's not. There's nothing clinical. Now, I would say there's nothing scientific, but I don't know. I mean, he might involve science. I know he involves like people that are licensed. Sometimes he has them sitting in the front row and everything, and I guess that kind of adds credibility to the whole show.
Yeah. And what's interesting is they usually get, so my mom loves Dr. Phil, and I mean, I'm terminally optimistic on some level, and I'm going, is it ideal representation of mental health? Absolutely not. But I mean, somebody's talking about it on some level, and you're right. I mean, is it exactly scientific? Is it exactly, a good representation of mental health? No, I don't think so. And you're right. And I think, for instance, with his YouTube channel, I mean, those clips float. I mean, I click on one and then I'll fall into a hole for like an hour, right? I mean, like, because you're talking about, isn't there like a guy who turns blue, or there's infidelity after infidelity after infidelity. And it's like, you're right in that it paints a very unfair picture of what mental health is. And then it also gives us, as other, say, we want to have a voice in the wider sort of culture of mental health, and that it gives us big shoes to fill in a weird way, and that when people come to our channel, they're saying, oh, okay, so you're going to analyze somebody, right? You're going to, or to show them the tough love treatment or something. And it's like, well, that's not actually how most of this works,
Yeah, there's a part of that show and that whole kind of movement, but again, I think he's kind of the primary driver, or at least of the television part, that you have to worry as a professional, at least a little bit, at least I do, that some of those people, I know they probably sign tons of contracts, right, that say, he's not licensed, this is not therapy, don't expect to be helped. Maybe the contracts even say you'll be harmed. Like, who knows what they say, right?
Right.
But, I mean, that's very seductive, right? The chance to be on a television show, and you can tell all your friends, I'm going to be on, Dr. Phil and all this stuff. It's a lot of attention you'll get, and you have to wonder if that's really good for people in those situations, right? Good for people who are fighting terrible relationships and tough circumstances, infidelity, mental disorder symptoms. Is that really the best thing therapeutically? I get that he's got the experts sitting in the front row and everything, and I'm sure they do follow up with the people and all, But still, I wonder if is that really helping? Is that what we want to do, right? Like, if I had, access to an unlimited number of people who wanted to come on my show and talk about their mental disorders, I would feel very uncomfortable every single time. I don't know how I could make that work.
Yeah, and I think that you can't say this, and not talk about some sense of selling out, right? As a mental health professional, or as a, sort of personality, right? I mean, I think I read $80 million a year doing this thing. And I know I sound like a bitter Betty here, and I'm like, I wish I made $80 million a year, shoot, but at the same, so you're right. It's seductive on both ends, I think, both for the folks who sort of want that. I mean, because he has made a star. I don't know if you know Danielle Bergoli, who's Catch Me Outside, How About That Girl, and she's this phenomenon in the YouTube community amongst younger people. She's more involved with sort of the hip hop community, and does, she's a musician, these sorts of things. And she originated on his TV show, right? And so he's also apparently a star maker, and then so from our end too, as professionals, and we're going, wow, okay, that's $80 million a year, and all I got to do is drop my license and, start, I don't know, some kind of television show where I don't know what you would call what he does, but and it's seductive, right? And so there is an element, I guess, on some level of selling out, right, from our side of it. Like, because we talked about this sort of briefly in our conversations preparing for this, about, if you look at the community of the so-called drama channels, okay, and I use air quotes and I use them derisively, because, we can get into that some other time, I guess, but essentially, they're they have a lot of viewers. Their videos get tons of views. And as a matter of fact, I've watched channels shoot up from like 1,000 to 5,000. We saw a recent example of what we would say the power of drama YouTube subscribers. It's effective, it's powerful, it's seductive from the content creator's perspective, because even, I don't know about maybe with you, but as I've been, like I said, the most views on my videos are the ones where I'm commenting on some sort of drama, quote unquote. You see, and it's seductive. And if you kind of equate that on a grander scale to what Phil McGraw's doing, which he's essentially, he's commentating on the drama of this, of these people's lives and where it is that intersects with mental health. So it's a very powerful thing. It's a very seductive thing. And I don't know where I'm going with this, but I sort of just wanted to highlight that. What do you think about that?
Yeah, and then to build on that, you could argue that, and I don't know if he's making this argument, right? But this is something that if I was thinking about like defending it from his perspective, maybe he could say, well, okay, yes, it's drama, maybe even selling out, right, quote unquote, right? But what if 1 out of 10 people realize they have a similar problem and go seek treatment, or 1 out of 20, or 1 out of 1,000, right? So it gets into this, okay, I'm entertaining the masses, but there are going to be a few people that learn something helpful, even if they didn't go with that intent.
Right.
So, and when you have an audience that huge, when you put up videos and they do millions of views on one video, yeah, you could certainly make a mathematical argument. In terms of the drama community, I think it's very difficult, and you really touched on this very well. It's very difficult to see video after video that you work very hard on, do okay or do reasonably well, and then see one that only has drama value, right? No actual accurate information is being conveyed, right? No information was harmed in the making of this video, right? Right? And that video skyrockets, right? And brings a channel up into like YouTube popularity, or whatever the level would be. I can understand why legitimate licensed professionals and other mental health people, right, other people with mental health educations like training, will say, okay, well, let me just make a few of those, right, just so I can keep my channel alive, pay the bills, keep the lights on, right?
Yeah.
And then you start realizing, well, I'm kind of wasting time by making the good videos. I just need to make the videos that score the views. And before you know it, your channel isn't really something that you've had a hand in shaping. You've just fallen to the contour of the landscape. And that's a strategy, right? That's a legitimate strategy. Somebody could say, well, you can just chase the trends. And I've said many times, I don't think there's anything wrong with that. But you can't really chase the trends and say that was your vision, and you can maintain your vision and what your message. So your message is just to kind of reiterate and put a twist on somebody else's idea. I can see that as a part of it. But what happens, I think these channels get wrapped up to where that's all they're doing. That they're just really reflecting. I guess like from a counseling point of view, we'd say it's a reflection, right? Not a parroting, but a reflection. And they're adding some value in theory. And I guess the more value they add, the more you can make that legitimate. Like your critiques, you add a lot of value, right? So that's not really, to me, that's hardly trend chasing. The trend is just there to help get some interest. But your videos are original. But some of the videos I've seen on other channels are just, there's literally no new information. Like you could watch the original video and
and at that point it's sort of like, what do you do when you see that and you look at these videos and it's not, let's just put a disclaimer, we're not critiquing or criticizing anyone's, we'll call it hustle. That's what they call it in the community. I'm learning all the time these new words, let me tell you. And the hustle being up, coming up, trying to build your channel, trying to build your brand. We're not critiquing it from it's from a personal perspective. Now, granted, art is often personal, and so people can maybe interpret that as personal. But I think on some level, it's you're right. I think if you were to look at it, and there's not a lot of new information. Because I'm part of and I'll admit it here, and this is going to haunt me, I know, but I watch some of those commentary channels and some of the quote unquote drama channels because it's the fastest way to get a sense of what's going on, right? Because there's the trending news channels are part of it, but to get to know because YouTube is a microcosm, and there are things that happen on the daily basis or maybe weekly basis that can, that you want to know, right? Instead of me trying to chase all of it down, and then some of them are quite good, and I don't, I'm not going to do a shout out or anything like that, but there are some that do have quality and that offer their commentary that is nuanced, that is sophisticated, that's empathic in a way, and sensitive in some levels, but also accountable or hold accountability. But then you're absolutely right. There are those who just get on there to, I don't know, say something for the sake of saying something, which, it is YouTube. That's the cool thing about it, is that if you want to have a voice, and that voice is literally nothing original, I guess you can do that. And so I guess sort of my point is that it's quite seductive, and like I listened recently, with this controversy. I've watched a lot of critique videos, and I almost sort of lost my own sense of self in that. I kind of had to step away because I had to separate what I knew from what was actually going on versus what other people were saying, and so on and so forth. In losing my sense of self, right, and essentially, what a lot of the commentary was about being qualified, quote unquote. But here's the rub. If we're qualified, you and I for all intents and purposes, would be considered qualified, and we're hesitant to do it, right?
Right.
And so it's almost sort of like this cosmic irony where there are the grapes, yet if we only reach for them, right? And so I don't know, I suppose that's my whole point to all of it, is just that, I think, we'd mentioned this when we spoke once before. We don't have a structure in our profession to talk about these things, right? And that says, well, you shouldn't go on YouTube, you shouldn't critique popular YouTubers. Like, that's not in our ethics necessarily. So, I know that you had a great video released recently about psychiatrists commenting on this sort of thing, but that's the only profession that I know of that has that.
They certainly have the most strict rule with the so-called Goldwater Rule, Section 7, I think, of their code. But yeah, you're right. The other mental health professions, even as I was making that video and kind of reviewing, like preparing for that video, the wording in there, like the APA, the wording is not quite as potent as what we see with the American Psychiatric Association. Right? They're both APA, right? A little confusing, psychological and psychiatric. But yeah, the NBCC. Or even the ACA, depending on, states use different codes, like the state of Delaware uses NBCC. They're really not saying a whole lot, except for if you're going to do counseling, the person has to be your client. And if you're going to make public statements, you have to be in line with the code of ethics. So you can piece that together and say, okay, I can't diagnose somebody unless they're my client.
Right.
But it really kind of leaves a lot available to counselors to get out there and say, well, I've noticed that this person did this, in some video I saw or on TV, and this brings up an interesting point about anxiety, depression, OCD, whatever you thought they had, whatever symptoms they had. But then again, when you're trying to infer somebody's mental state, that's the slippery slope, right? Like if we were behaviorists, right? Instead of I tend to emphasize cognitive existential therapy, right? But if we were like strict behaviorist, I think our rise through the YouTube ranks will be much, much easier.
Yes.
Right? Here's what they did. Right? No one can argue. Here's what they observed. Right? But behaviorism is, very dull. Right? As a YouTube topic. So
yeah, exactly. And I think looking at sort of how do you approach it then, right? Because, and I guess it sort of depends. And so for the voice that you want to have, as a newer creator, I'm still finding my voice. I put out lots of different things, reaction videos to very like oddly satisfying things, or I've answered questions of viewers. I'm sort of playing with lots of different things. I think for your channel is a great example. You found a nice rhythm, and I know that most channels will really, you'll find a rhythm, and I'm still finding mine. And so I've played with the idea of, can I take the positive spin, highlight the positive things that are going on in popular YouTubers, and kind of, in a way, sort of using their notoriety in a way to lift myself up, because that seems to be the algorithm's, thing that they like, the algorithm likes. And I mean, that's been like relative success so far, but it's hard for a new creator coming into this to say, first as a mental health, because it's already niche, but then as a new creator who YouTube is like, you can spend a lot of time, a lot of hours carving out these things. Mm-hmm. And so, I guess on some level, the ethics of it all are still up in the air, but then also, where is that line? And I know that you did a nice recent interview where you kind of interrogated this idea, right? You explored this idea of where's that line, and where can we as YouTubers and mental health YouTubers make the most, I don't want to say progress or impact, right? And kind of using that line. And you talked a lot about commenting on the mental status of things, and of course avoiding diagnoses.
Yeah, well, this is kind of what happens. You're talking about the drama channels, and I agree. This isn't certainly not to impugn them or judge them. They actually do what they do very well. Mm-hmm. No one can argue that. In a sense, they're really a driver, right? They find an idea. That idea echoes throughout all the drama channels, and they drive it. They make it into something that then can pull in views. Right. So in a sense, as non-drama creators, sometimes we can throw our lasso around that bull, right? Mm-hmm. and get pulled for a while. But it's, when you mess with the bull, you have to worry about the horns, right? As that phrase goes. Yeah. So, it puts us in a tough spot. There's what's ethical and what we're allowed to do. And my guess is we're allowed to do a lot more than we are. Mm-hmm. And then there's what do we want to do? Like, how far do we want to engage, into this realm? And that's really, I think, ultimately, if you look at ethics, I mean, that would be the real struggle, right? It's, you have the ethics that are imposed on you, which we agree to follow, but then you have those internal ethics that say, I don't know if this is just my brand. I don't know if this is my professional value coming through. Right. I mean, you could make a fair argument that what Phil McGraw does, I mean, he's not bound by any licensing board. Mm-hmm. So in terms of like the ethics of TV, he's probably in line with that. Mm-hmm. But does it feel satisfying, right? Mm-hmm. And if you look at the drama channels, they're not bound by any ethics. So, I mean, again, they can kind of do more or less whatever they want. Mm-hmm. And they have good success using that flexibility to be creative. Mm-hmm. We're driving in a much more narrow lane of the highway. Right. They have like a runway size lane, and we have one that's like 8.5 feet, or whatever. And we have very little maneuvering we can really do. And I feel like the closer we get to what they do, you start to lose credibility. You start to offend people at a higher proportion, right? All videos are going to offend somebody, but, at a higher proportion. Yes. Yeah, it's a difficult balance. But at the same time, I can see the other side of the argument, which I think is what you were kind of speaking to, which is if we're going to be relevant, right? If we're going to be, in a sense, YouTube popular, famous, or successful, whatever that means, we have to get in the game and play, right? We have to put the gloves on and start swinging. Yeah. And how do we do that? That's the challenge.
Yeah, I agree with you. And I think, it's because, I have this sort of, I'm rather contemptuous of the ivory tower sort of notion amongst, mental health folks. I don't sense that from you at all, but there is this sense that, well, I have a license and I can diagnose and these sorts of things. And, and then we isolate ourselves, we insulate ourselves. And then we wonder why there's a stigma. We wonder why there's clients aren't showing up or whatever the case may be. it's because we've isolated ourselves so much as a field, a profession at some level, that because we're so afraid of either being unethical or that we're so up our own tailpipe in a way that we can't be touched, that you just simply wouldn't understand, or whatever, the sensibility might be. And so I've had this in my struggle in myself as a clinician for years, is I want to engage, say, new modalities, new things, like for instance with like texting message therapy, or these other sort of online platforms and things. So my Myers-Briggs, we've talked about this. My Myers-Briggs is open to new ideas. I love ideas. I love new. I love, it's part of the reason why I love YouTube and why I've been sort of enamored with what I'm, my channel now, is it's new, it's fascinating. I want to see how things work. And so I'm interested in that for mental health. Whereas a field that seems very hesitant to change, very hesitant to engage, and rather, I don't know, I'd say risque things, right? Mm-hmm. Now, of course, Dr. Phil sort of being the way other opposite side of that, but we're so, it's like a pendulum, right? We're so way over here that even if we inch over a little bit, we're still not him, right? Right. And so for me, it's this constant sort of intellectual struggle to understand and to push things a little bit to see what's on the other side. Can we engage people that don't necessarily think about mental health at the top of their list, or something like that. And can I poke my colleagues in a direction that's towards progress? Because we as therapists can get very staunch and very stuck in our ways. And so, that's sort of my professional debacle.
Yeah, I was thinking, I'm used to arguing this from the side that I'm on, right? Which is, in terms of YouTube performance, conservative, right? Mm-hmm. When I make a video, I like it to be relatively conservative in terms of, like, I'm not taking chances. Not conservative like Democrat, Republican, right? But conservative, you know what I mean? So if I was to argue this from the other side, you could actually make a case, I think, for we'll call the pursuit of drama, right? Or the harnessing of the power of drama. Right? Yes. And it would be that, and this goes back to the ivory tower you were talking about before. Like, we both know a lot of technical terms, right? And if we were like really narcissistic and we were treating a client, we could speak in a language that they probably wouldn't understand because we could keep it all highly technical, very, scientific, and deliberately out of their reach, right? Which is not a good way to communicate with a client, right? It's not productive. It's arrogant, and it doesn't do the client any good. So most counselors recognize that you have to translate into a language that a client will understand. Right. Not that they're in a lower position or anything, but just speak in a way that they'll understand you. Right. When you relate stories, like when you hear a story and you relate a story back and you kind of reflect, you're using the analogies they bring up. You're using their life situation, right? So if they're really into cars or whatever, you can make an analogy about cars. If they're really into, like, if they work at a restaurant, you can make a restaurant analogy. Right. So maybe YouTube drama channels, maybe that's a language, right? And maybe by being more dramatic, like chasing those themes, we're not only reaching a new audience, we're more effectively communicating with a new audience because we're speaking a language they already totally get. Right. I love that. Yeah, and I love that. And it's sort of stumbling on that, and stumbling on the, what, because that is cutting edge, right? And it's going to make, and cutting edge is sharp, and some people can get cut. And so I absolutely love that analogy of language. And I think speaking to, speaking to folks that are using their language. And then, like you said this earlier, you said the drama channels, again, quote unquote, are very good at sniffing out the trends, sniffing out the stuff that people are going to be interested in or wanting to know. And we as counselors, we're always a step behind, right? We're trained to be sort of behind the client. Generally, we're not stepping ahead. Right. So we're always a little late to the party anyway. And I love that you said that, because it's an interesting opportunity for us to reflect as a profession or as professionals and go, okay, is where we are, or do we have flexibility in where we are? Do we need to be ahead of the client sometimes? Do we need to be behind? Do we need to be beside? And are we using the language to educate and to engage? And then, or are we getting stuck in our ivory tower? And I think a healthy self-assessment
is always a good indicator of kind of, one, I think it shows humility, because I think we as a profession, again, can get in our ivory towers and get these, behind our ethics, and that's what it is. And nobody knows anything. But then also it keeps us moving forward. And it's, it's like, okay, we don't know where the line is, but we can inch towards one. It's there, right? It's almost as if you're sort of chopping through the jungle, right? Where is it at? And I love that. And I think, because I hesitate to throw away, and I've said this in my response videos, I hesitate to throw that away because it is so powerful. There's something there that we can use. And I think the language piece is one, and the ideas like that you talked about or is another one.
Yeah, there's certainly, there's something to be said for success. Not success at any cost, but success.
Mm-hmm. Right.
And the dramatically oriented channels are very successful. Mm-hmm. Right? They have tapped into the interest of people that are watching. A lot of people are watching YouTube. So yeah, I agree. There's a kind of an uncharted frontier ahead of us, and it will be somebody that responsibly kind of moves toward that boundary. Right? Yeah. Maybe it'll be you.
Well,
right? Who knows?
It's a lot of energy. Those drama channels work day and night. I'm serious.
Well, I have to give them credit there too. Their work ethic. Yeah, I agree. It's impressive. All right. So we had a few connectivity issues here, some internet problems, which are inherent with this type of video, unfortunately, but I apologize. We were talking about the kind of the drama channels and just the dramatic content in general, covered a lot of territory. Do you have any thoughts before we wrap up, Nate?
No, first, I appreciate it. Thanks for technical issues. For some reason, I don't know, maybe I live in the 80s here and my internet's not particularly reliable. But anyway, nothing. I think the sort of final thoughts are just identifying and realizing that the drama channels do have some value, and that they do, for better or for worse, shape the conversations that we're having on YouTube. And I think mental health providers, particularly mental health channels on YouTube, should be cognizant, should be aware, should be have recognition of like the purpose of it, but then also that we are exercising that discretion, right? And exercising, and because with great power comes great responsibility, right? You've heard that. and that's right? Yeah, absolutely, Uncle Ben. And so there's never more of an evident example of that philosophy than it is with this. So that's sort of my final thought, is just that, I love that you talk about they're identifying, they have the ideas, they're using the language, and that we should be aware of it, but also exercise the discretion. And ultimately, that's kind of it.
Great. Well, a discussion I'm sure we can pick up again someday as we kind of see how YouTube evolves and how our channels evolve. And certainly, if anybody has any thoughts about this video, please put those in the comments. I'll put all the information for Nate's channel down in the description, so I would recommend checking that out. Nate, thanks for joining me today.
Thank you very much. I appreciate your time.
Thank you, everybody. I'll see you soon.